Hi, this is Dr. Pavanka. I wanted to talk about some considerations for sedation with pets. This kind of doubles with anesthesia too, because a lot of the things are the same. So the first thing we want to be sure of is that the liver, kidneys, and internal organs are safe enough to go under anesthesia. Sometimes we don't have this luxury if we have a pet who doesn't agree with being looked at. We do have some animals that they behaviorally need to be sedated so that we can do anything with them, and in that case, it's not ideal. And a lot of times those pets are getting a higher dose of everything because a lot of them do not allow us to do the regular dose because their adrenaline ramps and they won't let us get close. A lot of times we try to help with doing a pre-visit protocol, either doing the chill protocol where we do gabapentin, melatonin, and acepromazine, or doing something like trazodone beforehand so that we have some calming agent on board so they don't fight the anesthesia as much. With Village Vet, we have started doing gabapentin the night before in all of our surgeries, just to go ahead and help have a calming effect, because a lot of times they definitely know something's up when they don't get breakfast in the morning, which leads me to my next thing. Anytime we put them under anesthesia or sedation, we are concerned about vomiting, because if they vomit, they can't necessarily do anything to swallow it back down. A lot of times we look for a swallow reflex before we pull that endotracheal tube out of their throat after we are done with anesthesia, because we don't want them to vomit and have it sit there. Sometimes they won't even show signs of like hacking it up and vomiting. It'll be more like regurgitation under anesthesia. And that one's really scary too, because all of that acidity in the stomach just sits in the esophagus and tries to eat away the tissue. So that's where our monitoring really comes in. And at Village Vet, we always give our dogs an anti-nausea pill the night before so that counteracts that. The pill's a little bit cheaper than the injectable, but there is an injectable that also works. But the reason we do that is because we don't want it to sit there. If that does happen, we do have things that we can do. Some tables will tilt, so we can tilt them down so everything goes out. We make sure that the cuff inside, there's usually a little bit of a cuff on the endotracheal tube to prevent anything from going down the windpipe, so that we don't have anything going down the trachea that they're inhaling and getting pneumonia from. So we make sure that's a really nice tight lock so we don't have anything going around that, so nothing's going into the lungs. And then we will flush everything out and send home sucralfate to help make sure that that tissue is as nice as it can be with that irritation. But we don't want it to sit there. We typically will use suction and other things to help clean that up so that we don't have that acidic material sitting there. But that is one of the things we're worried about. And because of that, we typically ask that you don't feed them for a certain period of time before surgeries or anesthesia or procedures that they need to be under sedation for. So with that, we're looking at a specific time period, and it really depends somewhat on the individual. With most dogs and cats at Village Vet, we typically tell them no feeding after the night before. I've worked at clinics where it's been no feeding anything after midnight, but it could be earlier depending on what we're talking about. If we have a juvenile animal, we can have problems with blood sugar being too low if we do that. So we might tell you to not feed like 3 hours ahead of time. If you have a rabbit, that's another difficult one, because anytime we put them under sedation or anesthesia, they're very tricky. And part of the problem is their gut likes to shut down and it's really hard to start back up. So typically we were a little bit more careful about taking food away from those. And with our ruminants, where they're known for eructating and kind of vomiting it back up so that they can chew their cud and redigest it and send it back down to the next stomach, a lot of times we won't fully deflate that cuff on the endotracheal tube before we pull the tube. We'll leave it inflated so that when it's pulling out, it's kind of squeegeeing some of that potential material from the stomach back out so that we don't have as much issue there too. I typically also take this approach somewhat when we have those pets that potentially regurgitated under anesthesia. I don't have very many of those. I have had some that despite the Serenia had vomiting issues, but that's typically when they have like cancer that's pressing on the stomach that they can't get anything past. Or I had it before where we thought the dog got the pill, seemed like he did get the pill, and then we found out that that dog was really good at hiding the pill and spitting the pill back up, and even had us at the clinic having difficulty getting pills down. And the big concern again is having pneumonia from that, or having irritation and problems with the esophagus with that. We are very concerned about our lungs with that. But after we know for sure that they haven't eaten anything, so they're not going to vomit, that they have enough calming stuff on board to make sure that we can use the least amount of anesthesia as we can, or sedation as we can, and making sure that their organs are all healthy and happy and ready to work their hardest they've worked in a while, then we can go ahead and safely use our anesthesia or sedation. Typically, if we're doing anesthesia, we have an injectable that we give first, our pre-medication, and then typically an induction agent. It is safer to do that than to just go ahead and give them gas, because typically we need to use an unsafe amount of gas to get them under, and then the staff typically is breathing that too, as well as it's going into the environment. So typically we'll do a pre-medication, they'll make them kind of sleepy, but enough that we can go ahead and get an induction agent in. At Village Vet, we put IVs in every single patient that we have under anesthesia. If it's sedation, we might not. But the reason we do that is very similar to why they do that at your doctor or the hospital when they go in for an emergency, is if we have any issues under anesthesia, we now have an open port that we can give medications through, so that I'm not looking for a vein and trying to get a vein to work in an emergency situation. We do always also ask if you're okay with us doing CPR, so it's written down on our checkoff sheet if something does happen at Village Vet under anesthesia. That said, knock on wood, we haven't had anything really, and I really don't want us to. And a lot of that is because we try to do our due diligence and make sure that we don't have anything that we can find on blood work. We make sure that we have that IV in. We give fluids when they're under, because that helps the kidney and the liver to help, because they don't get as much blood flow to them, because we're giving them enough sedation to go ahead and slow everything down so that we can work on them when they're out. But that does slow down the blood flow to organs that the body doesn't see as essential, like heart, lungs, and brain. So when they're out, we're trying to make sure we have enough blood pressure, enough fluids to make sure everything is getting that perfusion, so that we won't have kidney or liver issues afterwards. But that's kind of the gist of everything. And then we really try to make sure that there's monitoring even under sedation. That's something that is sometimes hard to remember, because sedation a lot of times is more outpatient and it's supposed to be quick and easy. Then we reverse them, then they go home. But we still want to make sure that we have some monitoring devices on them to make sure everything looks good. And actually, I'm really happy the clinic that I work for, Village Vet, we just started doing that, where we have basically the same level of anesthesia monitoring we have, similar, that we just do for every sedation now too, which is wonderful. But that's my quick information on sedation and anesthesia. Typically on the other end, we're looking at animals who I swear they feel that we're not doing the stressful stuff anymore. So a lot of times they're like, okay, cool, I get to nap now. So we typically don't send them home until they're sitting up, walking, temperature's normal, and no issues that we can see. They typically go home and do want to sleep. And if they get any IV fluids, they typically don't really feel like drinking as much. A lot of times they can be upset to their stomach, just like we could be with anesthesia, so they might not want to eat for the next day. And sometimes the older guys might take a while to get out of it. I had one of my own cats. She lives in Chicago now with my parents. But she was one who ended up coming in because they couldn't find any way to take her, and I ended up taking her because she looked my childhood cat. So I went ahead and spayed her, and then about a month later I decided to take off a mask because I was concerned about cancer, because she was older. And did the exact same protocol, no issues the first time. Second time she slept for 3 days. So sometimes it really depends on them excuse me, and what's going on. But that's kind of the gist of sedation and anesthesia.